Good morning. Welcome to the NCBC webinar on supporting women and children after Dobbs. Our guests are Jessica Schmitz, an assistant director of the Front Royal Pregnancy Center, John Brahaney, the executive vice president at the National Catholic Bioethics Center, and Irina Grosu, founder and principal at Arete Global Consulting and a fellow of the Center on Human Exceptionalism at the Discovery Institute. I'm your moderator, Phil Cerrone, an associate ethicist at the NCBC. Sarah Czar, the NCBC's membership director, will help moderate questions at the end of the panel. Dobbs was a significant step forward in recognizing the dignity of all human beings, but it does not take away the challenging circumstances faced by mothers and their children. Today's guests will discuss the work already being done in this area, as well as further steps that local communities and hospitals can take in the post-Dobbs environment, and the policy legislative agenda that should accompany these efforts. Our first presenter is Jessica Schmitz, who is going to tell us about what pregnancy resource centers already are doing, what they have been doing for a long time, and also what community support they need to be successful in the future. Jessica?
Thank you, Phil. As Phil said, my name is Jessica Schmitz. I am the assistant director at the Front Royal Pregnancy Center, and I'm grateful for this experience. It's an exciting time for us to be talking about this pro-life missionary ministry and how we all can be involved. So on the day that Dobbs was announced, all of the pregnancy center staff and volunteers felt the joy of the political changes, but were very much hit with the reality that these political changes are not going to take away the pain and the sorrow and the challenges that our mothers are facing. And I really do think that at this time, the general public needs to become more aware of those challenges that our mothers are facing, such that we can address the challenge and support our women, support life. So I would like to give you all just a glimpse at some client profiles first and share a few stories on what our clients are facing. Our clients are facing all kinds of challenges, including broken relationships, social pressure, housing issues, juggling all kinds of challenges. And again, I'd like to give you a few client profiles. So on the day that Dobbs was announced, we were working with a mother who had felt uncertain about her first pregnancy because she was uncertain about her marriage, but with our support, she chose life. And yet she was pregnant 8 months later, when her baby was 8 months old, and again, uncertain if she could keep this pregnancy. From her perspective, the challenges were significant. He had just left her. So we spent that whole day working with that client, talking through her safety and housing and her finances. There were other clients that we were working with within those few days with similar challenges. Some of the mothers didn't want to tell their husband about this pregnancy because he had just cheated on her. Or the majority of our clients aren't married. So we would have clients who say, didn't think they could keep their pregnancy because they'd had the repeated experience of boyfriends leaving them once they found out that they were pregnant. So the woman's left behind with multiple children to take care of, and none of the boyfriends would stick around. I also mentioned social pressure. We have situations where there's interfamilial pressure. So the mother of a young client might be trying to bribe the client towards an abortion because that mother, or now grandmother, does not want to be that family with the teen pregnancy. Or some of our clients receive interrelationship pressure. The boyfriend is setting up the abortion appointment. The client isn't even talking to the clinic herself. And one of our clients needed our support because she was in this pattern of doing whatever he wanted to do, even if it wasn't what she wanted to do. And there are also cultural social pressure considerations. For example, a woman had come to us very recently who came to us after having chosen an abortion And she explained to us the reason from her perspective was that she was new to this country. Her primary social circle was in the office, her coworkers, and she felt that it would create office drama and she would be shunned by her coworkers if she was pregnant. So she ended the pregnancy for that reason. So these women are facing many challenges. I also mentioned housing. We've had multiple clients who come saying, I don't believe abortion is the right option. I don't believe it's morally right. And yet I have one scheduled. I have to do it because I don't have the right housing, right? So if we can provide them with housing options, we connect them to maternity homes, even just to consider those options and kind of calm that process, remove that challenge, then these women can choose what they perhaps already wanted to choose, which would be life. So these mothers are juggling all sorts of challenges that unfortunately are not addressed by the political change, as joyful as that is. Our executive director loves to point out that in the pro-life world, in the pro-life ministry, it's easy for us to think of those women just in the moment when they're walking into an abortion clinic. And yet we need to widen our view and think of all of the challenges that they're juggling and how hard they're working for their other children frequently. And if we can have compassion for their situation, we can more easily reach them and address the real issues. So that loneliness, the fear, the isolation, none of that has changed or been changed by the legal battles or successes in the legal realm. Thankfully, crisis pregnancy centers and other good pro-life ministries have already been supporting these women. We just really need to increase the intensity and our personal investment in this cause. It's a very exciting time. I would love to highlight just a little bit of what pregnancy centers do. We do provide medical services. The Front Royal Pregnancy Center is a medical clinic, though we have limited medical services, which are the initial pregnancy confirmation prior to prenatal care. We provide free lab quality pregnancy tests. We provide nurse consultations and also an initial confirmation ultrasound, which can answer many of the women's questions about how far along they are, whether or not the pregnancy is viable, very important questions when a woman is considering an abortion or thinking through what it would mean to carry this life. We also, in addition to those medical services, we provide lots of social material support and educational opportunities. And these are essential for these women, as I described, facing all of this pressure, social pressure, facing loneliness, facing financial difficulties. These women just need someone to talk to. A lot of us are blessed with friends or family trusted that we can call and say, hey, I'm going through a really hard time and I need to talk through this. However, not everyone is blessed with that opportunity. So many of our clients don't have anyone that they can call in these scenarios, or they might be facing those pressures and need a third party to listen to them and to give some peer counseling. So our peer counselor, client advocates are trained to just truly listen. We love thinking on one of the Sisters of Life's phrases, which is just let them empty their bucket. So we let them empty their bucket, tell us everything that's going on. We can affirm them for their strength. We can make sure they understand they deserve to be loved and cared for and deserve all that is positive and good, and soothe those fears. We're just so proud of our moms, and it's very important for them to hear that. So I really do think we should all take to heart pondering in this Christian culture, this pro-life culture, how do we build a life-affirming culture? A piece of that will be compassion for all those fears that the women are facing, rather than judgment. So we cannot be encouraging immoral behavior, and yet we have to be understanding of where they're coming from, and that from broken families comes brokenness, and we need to be helping support that. I also mentioned material assistance. So we are grateful to be blessed with all kinds of donations from the community. All of our services are no cost to our clients, but we also can provide in addition to our no cost nurse consultations or no cost ultrasounds, we just give all kinds of things that our mother needs. Our supporters give us baby clothes and furniture and formula and diapers and baby food. And the list is endless. There's just so much coming in the back on the donor side and going out the front on the client side the same day. I'll say, oh, this playpen, we're going to be giving it out today to some mother who really needs it. And that means a lot to our mothers. When I can say the community loves you, other mothers love you and want to support you in this. They want to support the children that you already have such that you can have hope in this uncertain pregnancy. So that means the world to our mothers, and it's a very important ministry. We're representing this Christian idea of sharing the goods that we have with the community, and that just blows people away. We're able to give where government programs cannot because we have no requirements on our funding. We are supporter funded and we're able to discern how we use those funds. So it's just such a delight to be able to be making good on our promise to be supporting these women, to be supporting life. And lastly, as far as services go, I mentioned education. So we have a lot of mothers who have not witnessed a stable family or feel very understandably afraid of labor. So we are able to have nurses giving labor and delivery classes, or mothers giving parenting classes, and all kinds of classes that just help make the mothers feel empowered and ready for this, prepared, supported. And none of this ends with delivery. It's definitely easy to focus just on that initial conversation where we're supporting the woman in this life-making decision. However, we emphasize that we're here for you. We'll be here for mothers coming back weekly for years. And we are able to provide material goods up through about age 3, but we have mothers coming back 10 years later to bring up social concerns or advice on their children, or maybe something bad happened in their life and they just really need a support system. And we're able to be there for them, supporting life in this way. So the question would be, what do we need now? We already have crisis pregnancy centers, thousands across America, which is beautiful, but we do need an increase in the connections between these organizations, increased community involvement, and just these strategies of how can we best support all the women. There will be more single mothers now in America. So I would say we need more support groups for these mothers. We should be considering, do our churches have support groups such that, say that mother I mentioned who felt that her coworkers were the only source of support she had, if she had had a church support group, would she have felt like she could go to that group and be accepted with this pregnancy and carry this life to term? Or moms groups, would there be similar social ways to fill those social needs that these mothers feel the need for in order to carry to term? We also need to be really pouring energy into these services that are helping the mothers with their material needs. So housing, we're going to need more homeless shelters for small families. That's already in need. We're going to need more maternity homes as we have more single mothers. And just thinking about increasing our connections between, if pregnancy centers have a client that need help with utility bills, can we be well connected in this cause? And there are great organizations already doing that, Her Plan, all kinds of organizations. So we just need to increase our awareness and our support of these places. And then, of course, there are all kinds of policy changes that we're all discussing. We see in our mothers a need for a more supportive maternity leave for our mothers. The topic of adoption and awareness about adoption. Does anyone know that adoption is no cost or low cost to the birth mother? Affordable medical care. I know we'll talk about that later. Again, there are fantastic organizations out there. We just really need to amp it up. This is the time. It's very exciting. And then lastly, I would just encourage everyone to really take to heart, take to prayer the idea that we all need to be involved. All those of us who believe in the pro-life mission need to be involved in some way. I really appreciated in the last webinar on this topic, William Sanders made the point that we all need to be doing something and we all need to feel the pinch. I think that was a very good way to put it. And I would just note that we are all called to different ministries. So for example, we need volunteers at places like crisis pregnancy centers. However, peer counseling is very heavy. We're hearing about all kinds of horrible challenges that these mothers are facing on a daily basis. And not everyone is called to that. It's very much a calling in each of these areas. Also, I would note that we are all called as Christians to be more supportive of those around us, those who are lonely around us. You know, in our church, do we know who is the pregnant woman who might be considering an abortion? And is there any way that we can support her? So if we can increase that awareness and investment in our mothers, while also noting the importance and the value of these organizations that are professionally trained, I would note that there are times when a professionally trained organization might be able to help connect a mother to more sources and better sources than the individual would, or it might even be more cost efficient actually for the organization to be working with her. And one example I would have would be many of our clients who are homeless are using hotel rooms as their source of housing. And they'll even be begging for the money to be putting into the hotel rooms. And so they're spending far more on housing than they would be if we were working through an organization prepared to help these mothers who can't quite afford their own housing. So just use that as an example of it's a beautiful thing if we give money directly to the mother, but if an organization could help that be done more efficiently, at times that might be the better option. So again, I just really encourage you all to be present to the lonely around you. As a Christian culture, we need to amp that up. Volunteer if you feel called to do so, your time or your talent to a crisis pregnancy center or another pro-life ministry. There are so many good organizations, call centers, resource centers, these organizations that are connecting all of the donors with the clients. And it's fantastic. It's beautiful how many are out there. And if you don't feel called to be volunteering, every one of us has a different calling. So consider financially supporting an organization and also just staying in touch with this news in the pro-life mission. There's a lot going on. We really need to stay in touch and advocating for what we believe. I do think that there's a benefit to us really understanding what's out there. We don't need to reinvent the wheel. We just need to put more intensity into what's already going on. And as far as addressing those women who come to us, I would just like to close with noting a couple of the phrases that we like to use in speaking to our mothers and in our marketing and trying to reach additional mothers. We love to emphasize that women deserve loving care and that we're just here to help. So while the political side is absolutely necessary, there's also this side where we're just open to the mothers, no matter what they're going through, and we're prepared to help them and show them compassion. Thank you.
Thank you very much, Jessica, for giving us some insights into what's going on the ground and also these opportunities going forward at the local level. Next, we have John Brahaney, who is going to tell us about what can take place at the level of Catholic healthcare and how it can become a real leader moving forward. John?
Yeah, thanks for the opportunity to present. I'm not directly working in Catholic healthcare. I have a role as Executive Vice President and Director of Institutional Relations for the National Catholic Bioethics Center. So we're dealing with consultations on very recent cutting edge issues, you say in brain death and organ donation. We do a lot of education of healthcare professionals, and we have an assessment program for Catholic healthcare called the Catholic Identity and Ethics Review. So I'm not speaking as somebody who is actively engaged in Catholic healthcare, but I have been. I'll say a word about my background here in a second, but I have worked in Catholic healthcare. I've also had opportunities to work with other organizations, such as the Catholic Medical Association for 8 years. And I was on the USCCB Pro-Life Activities Committee for over 10 years. So I'm sort of familiar with the USCCB's efforts in this area. And I've long been personally involved in the pro-life movement. I still recall taking an all-night bus trip to Washington, D.C. for the first March for Life in 1974. And I went to many marches after that. I've worked with crisis pregnancy centers, and I really do take Jessica's message to heart that, after decades of doing many things, it's time to step up and do more. Now when we have the opportunity to do more than ever, we need to do more than ever. So let me say just a little word about my background in Catholic healthcare, and then I'm going to go through 3 points that I'd like to share just for consideration and discussion about where I think Catholic healthcare could go. So after I got a PhD in healthcare ethics, I worked for 6 years as a director of mission services and ethics for a Catholic hospital in Western Iowa. And it was, we had the full service, everything from the ICU to a heart hospital to a helicopter that would go out and get people to a couple hundred beds. We sort of had it all. We had 30 some clinics. I really got to experience a very rich local Catholic health ministry. We were part of a 5-hospital network in the state of Iowa. And then our hospital was a member of Trinity Health, which actually was and still is, I think, the 3rd or 4th largest Catholic health system in the country. So I really got a sense of the rich world of Catholic healthcare. And my experience in that time, I would say, was that Catholic healthcare maintained fidelity on abortion, and many times over the decades has been pressured to offer abortions, under the name of emergency care and things like that. Trinity Health was sued several years ago, and people were trying to force it through the courts, to provide abortion services. I think Catholic healthcare has always fought that very successfully. They work hard to offer compassionate care, to everybody, but especially the poor. Everything from maintaining birth centers to mental health. There's a lot of good work that goes on, and Catholic health ministries have rich community benefit ministry programs where they are assessing local healthcare needs and working in many ways to address those needs. It's not all about hands-on clinical care. So there is a lot going on. My sense as I was working in that role was that in some respects, I think we felt our hands were tied on abortion. There was Roe v. Wade. It made it very hard to get anything done at the state level. So again, while we maintained fidelity, there just wasn't much we could do. But that has changed. And so here are 3 ideas that I have, and I'm going to unpack each one a little bit, of what I think Catholic healthcare could be doing in a post-Dobbs world. So one is going to relate to clinical care, especially policies in education. That'll be the first thing. The second thing will be improved advocacy, lobbying, and other forms of advocacy at the state level. And the third area will be improved compassionate and pastoral assistance to people who have actually suffered the trauma of abortion or are considering abortion and so on. So let me unpack each thing a little bit. I mean, Catholic healthcare, all different sizes, you might say, and complexities of the facilities, but in my experience, Catholic hospitals are sort of second to none in the quality of care they offer, in the, the range of services they offer. In any given city, they're often in competition in a lot of places with other hospitals, but they certainly stand shoulder to shoulder with them in many respects. This is a critical time, I think, for Catholic healthcare to do a few things in the area of clinical care. One thing I would say, especially in light of all the confusion that we know is being spread lately by people saying, in wake of Dobbs, women are going to be left to die, and all of these things. And these laws do not, laws on the books don't make exceptions for ectopic pregnancy or miscarriage or any of those things. I think that's pretty groundless, and I think that's been shown. The Charlotte Lozier Institute did a great report on state laws and what they actually say. But I do think it's a time for Catholic healthcare to, for organizations to take out their policies. Hopefully they have policies, even though everybody knows they're Catholic, that says we do not offer direct or elective abortions, and to look at their policies for managing other complex situations of pregnancy and just make sure that they are absolutely tight, that the terms are well defined, that the procedures are clear, and make sure that, everything is as tight as it can be. One of the critical things that happens in healthcare across the board is education. This is an opportunity for Catholic healthcare to educate its own employed physicians, educate the physicians who have privileges at the hospital, who bring patients in, what its policies are, how it can care for women, clinically, ethically, you name it, in difficult situations. But Catholic healthcare really, I think, could be an excellent locus for the education of physicians and other healthcare professionals about what is authentically ethical, what is clinically possible, and so on. And that takes me to one more thing in the area of clinical medicine, and that is quality improvement. Both in my time in Catholic healthcare and since, and one thing we do is assess some Catholic healthcare organizations, I hear over and over again about the importance of quality improvement in healthcare and how different departments and areas are always finding ways to look at all the factors that go into a situation and find ways to bring about the most optimal clinical outcome. I mean, there are hospitals that work to reduce the C-section rate because of the complications for both mother and child when C-sections are overused, and they've had great success. I was just in some Catholic hospitals, and they said they're doing miraculous things with care for stroke victims. I mean, they will come in unconscious, and they'll be moving again within minutes to hours. And it takes constant quality improvement, everything from the quality of drugs they're using to the protocols for action. And I think these quality approaches should be applied very directly to care of difficult pregnancies, and just care of women in general. Now that there are going to be new questions, new situations, you name it, bringing all the tools of quality improvement to bear on improving clinical quality for pregnant women, I think is certainly important. My second point was improving legislation and lobbying. Catholic health organizations are often significant players, if you will, advocates at a state level. Catholic hospitals are often major employers in a city. In my own city, the hospital, I think, had maybe 3,000 employees. It was a major employer in that city and in that part of the state. Multiply that by maybe 4 or 5 cities in a state and multiple Catholic hospitals, clinics, you name it, they are players. What could they do now that there's more room to do good things at the state level. I think one thing they could do is they could lobby for stricter standards for reporting abortion statistics. There are actually, there is no nationwide systematic system of reporting abortion statistics. Everybody seems to agree that the Guttmacher Institute has the best statistics, but they're obviously not an unbiased source. And you know, as with everything in healthcare, we need to know where we stand. We need to know if the trends are increasing or decreasing, and we need efforts to reduce the number of abortions. But a first step for that is knowing the data, both for surgical abortions and now increasingly chemical abortions, which bring their own damage, their own risks, their own impacts on the lives and souls of the women who are using them. We need better statistics. I mean, to me, that's almost a no-brainer. At the state level, I think Catholic healthcare could be lobbying for stricter abortion laws that are appropriate to states. You know, there are all kinds of states with all kinds of different situations. But Catholic healthcare, I would say, is very well placed. And a third thing, I think Catholic healthcare could lobby effectively and hopefully work with the state Catholic conference to lobby for more funding and more support for women who want to carry their pregnancies, for assistance with adoption, any number of good programs. I think we could bring the attention of our Catholic organizations and institutions to bear at the state level in a new way. Third, I would say the importance of a compassionate and pastoral approach now to women who have suffered the trauma of abortion. There's an ethical directive, Directive 46, that says that Catholic healthcare should offer compassionate assistance to women and men who have suffered the trauma of abortion. Just a quick story here. I remember when I was working in Catholic healthcare, I was in the old Catholic healthcare building, which was all administrative offices. And you know, we had our pastoral care offices up there, social services was up there. There was an infectious disease clinic office down the hall. And one day I walked into our coffee room and there was a woman, I wouldn't say she was homeless, but she looked like she was on hard times. She was in our coffee room. I was a little surprised. So I gave her a cup of coffee and she just started talking to me. I think she was there for infectious disease. Started talking about her life and her struggles, and I just listened. And then she said, you know, it all kind of went downhill after I had an abortion, you know, and I was 21. And I was so amazed that she would bring it up, you know, or even discuss it. Clearly she was suffering. And I think she was at that point, probably late 30s or 40s. It had been years away, but it obviously had a devastating impact on her life. There's a lot of research out there from the Elliott Institute. I think they maintain a website called afterabortion.org that shows that there are mental health effects. There are certainly clinical effects and social effects of abortion. And Catholic healthcare has an opportunity to respond to these. A couple years ago, I went to an event in Philadelphia where we could lobby a local secular provider, local secular system that was accountable to the community, and pro-life people would go and lobby them and say, yeah, we want you to stop doing abortion. And one year, a physician, an OBGYN spoke, and she said, you know, I just conducted a history and physical with a patient of mine who was a woman. And you have to ask about past operations and health issues. And I said, any past operations? And she said, well, I had an abortion. And this doctor says, normally you're doing this history and physical and you're just checking the boxes and all of that stuff. You go fast. She said, that day I decided to pause and just ask her if she was okay after that. And she said the woman cried. There was a lot of pain, and it was a very meaningful encounter. I think Catholic healthcare, which has a system of clinics and doctors, it's doing history and physicals, needs to build in a way to take that time to ask those questions. And when people express that pain and that loss, be ready to connect them to services. Dioceses often have Project Rachel programs. I know the USCCB Pro-Life Activities Committee did a huge inventory of supportive services across the diocese called Walking with Moms in Needs. I think they started it in 2020. And I think it's something that's ongoing. So there are ways that I think that Catholic healthcare can both think about how to care for women directly when these situations come up, and think about how to connect to the programs that the church provides, often through dioceses. So those are three ideas. Catholic healthcare is great. It has a wonderful witness. It has many resources. And one of my favorite quotes from ancient history was Archimedes. He was this Greek polymath. And he says, if you give me a big enough lever, I can move the world, And I think it's interesting to think of Catholic healthcare, all it is, all it has, it's a big lever. And I'm looking forward to seeing Catholic healthcare begin to move a lot of things here. The care of individuals, social efforts, strengthening the church, you name it. So thank you.
Thank you very much, John, for sharing those three objectives for improving high quality and patient-centered care. Last but not least, Irina will share her perspective on the legislation and policy that needs to be in place if these community and medical interventions are going to be successful. Irina?
Thank you so much, Phil, and it's a pleasure to be with all of you. Again, my name is Irina Grosu. I run a consulting company, Arate Global Consulting, that focuses on helping state and national groups with their pro-life, pro-religious freedom legislative efforts. I'm also a fellow with the Discovery Institute Center on Human Exceptionalism. And I was at a federal agency under the Trump administration working for Health and Human Services, doing communications for the Office for Civil Rights. And before that, I was at Family Research Council doing pro-life work. I'm going to split my remarks in three different areas. The first, I just want to give you an update on where we are in terms of the states in a post-Dobbs, post-Roe era. Secondly, I want to go through the threats and the attacks that are currently happening to, even though we are in a post-Roe era, there are threats that will continue to push up for abortion even now. And thirdly, what is our response and what can we do legislatively, as well as at this federal legislation, as well as state legislation, and also what we can do outside of the legislative process. So first and foremost, there are currently about almost 20 states that either have completely banned abortion or mostly banned abortion, and so there's pro-life protections. So 14 states already, Arkansas, Alabama, Georgia, Kentucky, Louisiana, Missouri, Mississippi, Ohio, Oklahoma, South Carolina, South Dakota, Tennessee, Texas, and Utah. And actually the abortion facility that was in Mississippi that Dobbs was based on actually closed on July 6th and moved to New Mexico. In Idaho, it's supposed to, their pro-life law is supposed to go into effect on August 25th, so just around the corner. And in Indiana, it's supposed to go into effect in September. Now, there's a couple states where their pro-life laws are currently blocked temporarily, hopefully. And that's in North Dakota and in Wyoming. And in Florida, they have a 15-week abortion ban, but sadly, since most of the abortions happen in the first trimester, Florida, even with its 15-week abortion ban, is still an abortion sanctuary state because women in the southern states there are still going to Florida for abortions. So this is to, even though we've done a lot and had a lot of progress since post Dobbs, post Roe, the pro-life, I cannot stress enough that the pro-life movement cannot rest on its laurels. This is not the time. There are a lot of threats, so I'll go straight into what those threats are, and then how we can answer to those threats. So the threats mostly are coming through federal bills that are being proposed and through executive orders from the Biden administration. We've already seen, for example, the Biden administration push for pharmacies through an executive order for pharmacies to refer for abortion, to give abortifacient pills. They're trying to use through executive orders, wrongly abuse EMTALA, which is the Emergency Medical Treatment and Active Labor Act, to try to push for abortion to be covered under emergencies. Obviously, an abortion is not an emergency if someone's having a miscarriage, et cetera. That's a different story. So they're abusing EMTALA, and then through the regulatory process. So if you're not familiar, right now, the Department of Health and Human Services, the Office for Civil Rights, where I used to work, just put out a proposed rule. And this would really harm hospitals, and John was talking about the Catholic hospitals, faith-based hospitals, doctors everywhere. They're pushing for some changes to regulation called Section 1557 that was under the Affordable Care Act. And under this, they are proposing to redefine sex discrimination to include not only gender identity and sexual orientation, which again would force doctors to perform transgender surgeries, et cetera, but the way that they're trying to include abortion in that is by including sex discrimination to also mean a pregnancy condition. And the way they define pregnancy condition is abortion. So what this would mean is that under this proposed rule, if it becomes, if they finalize it, which they will, it will require doctors across the United States to provide abortions and transition surgeries, or be fired or lose their funding, federal funding, under sex discrimination, actually. So there's a chance for the public, including organizations and individuals, to file public comments until October 3rd to object to this terrible rule that they're pushing through. So as you can see, there are threats that they're trying to go around a post-Roe environment by pushing abortion still. So that I guess Phil can send some more information. I have links if you want to file a public comment. It does not have to be complicated, but it's important that you stand up, especially the medical professionals on the call, but everyone involved. So I will go through some of the areas, both from a national, state policy and legislation, that we can incorporate to ensure that the post-Roe world is still, that we're increasing the states that are pro-life and that we're passing pro-life legislation. So just as a background, we really need to focus on elections still, not only at the state and local levels, at the national level, in terms of our members of Congress, so that we could get back a House majority. And a lot of the pro-life groups are focusing on the elections. So Susan B. Anthony List, Concerned Women for America, Students for Life, they are focusing on making sure that pro-life leaders are being elected. We also need to continue to pass pro-life laws, especially in those states that are abortion states right now. And the good news is that in this year, in this election, in this cycle, 43 states have introduced a total of about 441 pro-life bills that include about 650 pro-life provisions in those bills. We need to continue doing that, because even in the states that continue to have abortion, we can, as John mentioned, we can look over to ensure that abortion facilities are regulated, or that chemical abortions are regulated, or that we can put limits on abortion in those states. So there's still a lot of work to be done at the state level. At the federal level, even though right now it would be hard to pass legislation, The bills that are focused on, that they are focusing on, is the No Taxpayer Funding for Abortion and Abortion Insurance Full Disclosure Act. And this would codify the Hyde Amendment, which ensures that no federal funds could be used for abortions or to subsidize health plans that cover abortion. The second federal bill that's a focal point is the Born Alive Abortion Survivors Protection Act. And this is to protect all babies who are born. So it would criminalize infanticide and clarify that the standard of care that must be given to babies after failed abortions. A third federal legislation is the Pain Capable Unborn Child Protection Act. And as we've seen through, especially recent times, our technology has improved, our science has improved, and we can see that babies can feel pain in the second trimester early on, as early as 12 weeks, between 12 and 20 weeks. And so it's important that we protect babies who can feel pain. And there's also the federal bill, the Conscience Protection Act. And that, again, as I mentioned before, there are a lot of threats to conscience, medical conscience of professionals, of healthcare professionals. And we need to ensure that their conscience rights are being protected. Other areas that when we talk about policy that we can incorporate are tax credits for families. And in fact, a wonderful thing has happened in Georgia, where they are giving tax credits basically for tax deductions for preborn babies as dependents. They're considered dependents in Georgia. That was a new development post-Roe. Also, legislatively as well, and at the state level, federally and state level, we can focus on increasing funds for pregnancy resource centers. As we know, Texas actually gets $100 million in state grants for not only for pregnancy resource centers, but to help moms with homelessness or social services, whether it's through adoption, foster care. So more states need to do that across the board. That Texas has the Alternatives to Abortion program, and I think other states need to really increase their funding for these services, especially in a post-Roe era, as mentioned, because of the increase in the amount of women having babies and the increase in needs. Another area legislatively that we could work on at the state level and at the federal level, but I think we can start at the state level, is to limit what happens with chemical abortions in terms of, for example, they're sent by mail, and they could do they could do health services through telehealth, and those things could be limited so that women aren't endangered as much. These women are now having miscarriages, their abortions, and babies in their own toilets by themselves. So, and we've seen a huge increase in the number of chemical abortions because they try to sidestep laws, especially in a post-Roe era. And the most updated information we have is that 54% of abortions are chemical abortions, and that's 2020 numbers. So I'm guessing it's probably more in the 60 to 70% of range of abortions right now are chemical abortions. Another area is promoting adoption and foster care reform and encouraging family-friendly and work-friendly employment, and defunding Planned Parenthood and the abortion industry. At the very local level, I mentioned this in the last call too, there could be sanctuary cities for the unborn that people can help to improve and to pass with their local cities promotion. Non-legislatively, I do think that there are a couple of areas that we can also focus on, and this really makes it easy to just take action right away. And I will specifically focus on churches, as well as turning pregnancy resource centers into medical centers. So first and foremost, I think that there's a great opportunity for us now. We have 3,000 pregnancy resource centers, and a lot of them, if they had the funding and the right medical personnel, could become medical centers. They already have a brick and mortar place. And so the two the two challenges to that right now is funding and the doctors, especially the OBGYNs. And so I suggest that as a pro-life movement in response to a post-Roe era, that we start a medical fund for full service medical clinics. And that's for the entire quality of care from not only prenatal, but postnatal as well. Planned Parenthood advertises that they do medical work. They actually don't. But we have to realize that the delivery of abortion, which is death, is through the healthcare system. And so the way that we can improve this is by making sure that if people get the healthcare they need, these women who are in need, and they can get full services through our pro-life medical clinics, they won't be tempted to go to Planned Parenthood and other places like that. And also, especially since we have a lot of medical professionals on the call, it's important that the ones who are involved with OBGYN work and pediatric work, that if some of them are willing to step up and actually decide to take over a pregnancy resource center and have that be their actual practice, and take over the pregnancy resource center and turn it into a medical clinic. That is what is needed. And there are conversations right now among pro-life organizations about those efforts. And then also with the churches, churches have a great responsibility, as was already mentioned, to help women who find themselves in unplanned pregnancies. And they are the first communities for women, especially single women and women who find that they don't have support elsewhere. And so I think it's a great opportunity for lay people to also just start support groups within their church, to go to their priests, to their pastors and say, I want to start a support group for pregnant women. And that alone makes all the difference for these women who are facing unplanned pregnancies and who are tempted to abort. And then lastly, and this was another suggestion by Students for Life, was supporting pregnant and parenting women on campus. All of these are some of the ideas, both legislatively, policy-wise, and outside of the legislative process, that we can continue to build a pro-life world post-era. Thank you.
Thank you very much, Irina, for sharing the political challenges and goals that have emerged since Dobbs. We have a few questions already. Just remember, everybody, that there is still time to submit questions. So if you have any, please send them to Sarah. The first question goes out to everybody, that as a faculty advisor, how can one promote on-campus pro-life student groups? Specifically, do you have any recommendations for reinvigorating groups that might already exist? Irina, you were just with a bunch of Students for Life, things like that. Let's start with you.
Sure. Definitely. I mean, when I was at Notre Dame and I was running Right to Life there, we faced a lot of, even at Notre Dame, we faced some pushback when we tried to put crosses on the campus lawn, et cetera. So I think that faculty members at universities can work to advocate for pro-life groups, especially if they're being bullied. And actually, there have been some groups that have even filed lawsuits against their universities if they were bullied by them or given different treatment than other groups because they were pro-life. So I think that faculty advisors are very important in that and helping students navigate that. Also, I think it's important to see if, for example, if your university has a medical training center, or to see are they doing any research using aborted fetal cell lines, et cetera, and that's something that you can bring to the attention of the pro-life group and shed light on that, the way that, for example, David Daleiden and some of his work he did to see is that the case. And also, if there is a pre-med program, et cetera, just know that some of those students are actually being targeted if they're pro-life. A lot of these programs actually have an opt-out of abortion training instead of an opt-in. So a pro-life student who's in a pre-med program or a medical program oftentimes are being forced to train for abortion and would have to go in front of their faculty board to say, I don't want to be part of this, I want to opt out, instead of the opposite. And students are very vulnerable because, look, they're trying to have a career in medicine. They're being outed as you're pro-life. So I think it's important for any faculty members at any university to look into those issues and see if that's happening on your campus. And then, of course, helping the pro-life groups on campus to do more. So, for example, to make the campus more mom-friendly and baby-friendly. Do they have changing stations in the bathrooms? Do they have housing for pregnant women? And those are simple things that you could do on campus to ensure that it's pro-life and that it welcomes babies. And also, is there a daycare service? Are you working closely with the local pregnancy center near campus? All those are ways that you can take action right there locally.
Excellent. John, Jessica, do you have anything to add to that?
No, I don't. That's kind of outside my area of experience.
I would have two ideas on how to revive the pro-life groups on college campuses. One would be finding those pro-life organizations that you have near you, so perhaps a pregnancy center, and take a trip there. So if the college students could go see what is being done at the pregnancy center for pregnant moms, those college students are valuable advocates. They're the ones who are going to hear, in the bathroom, the girls telling the girls that they're pregnant, that kind of a thing. And so if you can really arm the pro-life students with personal information on, I know a place we can go to talk to an expert, that would be, that firsthand experience. Clearly, we have a lot of clients who come because of their college friends who brought them to us, which is beautiful. And then the second would be considering, so students going to these organizations for a tour. And then the second would be bringing those organizations to your campus. If you have some sort of lunchroom where they could have a table or something, if the college students that are not part of the pro-life group could be introduced to some of these concepts. I know we've done that in the past where we brought baby models and quizzes and different things, and just had really interesting discussions with students who may or may not have been pro-life, may or may not have considered some of these discussions. And so you could work hand in hand with a pro-life group and some organization. Most organizations would be very happy to come for a visit. They would love an invite.
Thank you very much, Jessica. That was very good. Now, real quick, before we move on to the next question, is there anything in particular? I know that Christendom works very closely with the pregnancy center. Are there any specific kind of strategies or lessons learned from that particular relationship? In addition to what you've already said, if there's anything else.
That's a good question. I'd say that we've found the students who have been client advocate volunteers have been a fantastic resource. They're really able to meet our clients where they're at and bring in this fresh perspective where our client set is becoming younger. And there's a lot of wisdom that an older volunteer can bring. They have experience perhaps being a mother or a degree that's applicable. And yet there's also a lot of benefit to bringing in young volunteers, as long as they have this understanding and ability to connect with the client. They might have just a specific connection, understand some modern concepts that will help them connect more quickly. So I would say if you can find resources of young, if we can connect the young interested pro-life members with the clients, that's been a significant benefit. And then also just interesting discussions on, so Christendom College is has a very Catholic campus, but you can have teen pregnancies anywhere. So if that would happen on campus, then what is the student body reaction within a small Catholic community? I think that that we've learned lessons with them about the importance of being okay talking about these things. You know, if it happened, then how do we support the women?
Great. Thanks a lot, Jessica. That was very, very good. The second question is for John. Can you explain a process you have seen to promote quality improvement in a hospital? Like, what are some general steps on who to connect with? And what kind of data do we need to collect to have confidence that the changes, these pro-life changes that you propose, are actually improving care and support for women?
Well, I did give one or two examples. Quality improvement in healthcare has been an emphasis, I would say, for over 20 years. And when I was in Catholic healthcare, which was between 2000 and 2006, every department was supposed to have a quality initiative. Now, that meant something very different in the pastoral care department, as opposed to the emergency department or something like that. But, quality improvement projects, there are just all kinds. I mean, I've my personal story of being in a couple of ERs recently and hearing about amazing things going on in stroke care, which are the result of 20 plus years of effort to do things like improve what's called door to drug time. But there are actually a number of other things. Again, I just talked to these ER docs and they said, we found out that a key medicine or drug or whatever it is we give to stroke victims has to be specially mixed in the pharmacy, and there are 2 or 3 components. And we said it's not working. We need it faster. So somebody invented a single bolus drug that doesn't have to be mixed. I mean, these efforts go on all the time. And you could probably find many, many other stories. I think, though, what has to happen is some of these things need to be applied, again, to best practices in difficult pregnancies and things like that. I remember there was a famous case somewhere in the Southwest a little over 10 years ago where a Catholic hospital made the mistake of performing an abortion on a woman with pulmonary hypertension because they feared her life was at risk. After the fact, I talked to a maternal fetal medicine doctor who practiced at University of Southern California. And he said he and his partner had gotten 25 women through pregnancy with that condition. It could be done. And there are risks, but an abortion is a 100% risk of death, certainly for the child. So there are many things. I would say one thing that goes on in quality projects is people are looking at multiple factors that play into a given situation. I mean, it could be everything from the drugs they use. For something like C-section rate, I know a research paper I have said, the doctors had a sleeping room, and it turned out the further away the sleeping room was from the delivery room, the higher the C-section rate. So one thing they did to reduce the C-section rate was move where the physicians could crash for a while closer to the delivery room. I would say pretty much every hospital has a quality department where they are collecting data all the time on everything that goes on. And all of that data, in addition to the things I just mentioned, is important to bring to bear. And in a quality project, you always want to know where you stand, what the stats are now, what the level of understanding is now, what the attitudes are now, and where you want to get. What are your goals? And you measure that over time, and you do this over a year or 3 years or 5 years to get there.
Thank you very much, John. Our last question is for Irina. We got time for one more. It's kind of a 2-part question. The first part is, what would you say about the concerns that have been raised by some Catholic hospitals that pro-life legislation will be too restrictive and prohibit procedures that are ethically permissible, such as removing an ectopic pregnancy? And what role should Catholic organizations take in helping to refine legal language at the state level? And then the second part is that if you had to choose one of the legislative initiatives that you talked about, which one do you think is the most practical to start with? And related to that, how much can states really do if there's a pro-choice federal administration?
Thanks, Phil. Okay, so the first question, especially as regards to ectopic pregnancy, I think some of the misinformation out there, of course, is that that the way to resolve an ectopic pregnancy is not an abortion, but obviously from the Catholic perspective, and here I put my bioethical hat on, obviously we know that there are ways that it can be done ethically, and there's ways that it is a direct attack on the baby. So I think that, especially as Catholic institutions and ethical professionals, medical professionals who can speak into this, is to show that obviously there's sometimes that, for example, with let's say, for example, with ectopic pregnancy, to differentiate between that, between a direct attack on the baby versus it being a secondary action against, and that is not directly intended to kill the baby. So I think that as far as possible, especially as these bills are being considered, that it is an opportunity for people in ethics to help with the language, with that bill language. But as we know, the biggest talking point and the biggest messaging point is that abortion is never necessary. So to show that, sometimes with ectopic pregnancies, for example, that ectopic pregnancy resolves itself, but that there are also ways to ethically handle an ectopic pregnancy. In terms of practical legislation, the one that comes to mind, and I think it could get bipartisan support, is to fund pregnancy resource centers and supports for mom. It seems like a no-brainer that, for example, even if, let's say, in a pro-abortion majority state, let's say that they don't necessarily want to fund pregnancy resource centers, even though I think that we can get that passed in a lot of states. They could at least say, we'll give more funding for social services for single moms, for adoption or foster care, for homelessness, et cetera. So I think that is a way to really engage with the other side, and to say, look, you care for women. Here you have a lot of women who could use these services. So I would recommend to start there, because with a lot of these federal bills right now, they're not getting passed one way or another. For example, one big threat is the Women's Health Protection Act, which, if a Congress looked differently, that would codify abortion across all states. On the other hand, if Congress looked differently, we could potentially pass a no taxpayer funding for abortion or a pain capable bill, et cetera. But I think that at the federal level right now, it doesn't seem like we can do as much on those issues, given the current state of the makeup of Congress. So I start locally, again, start at the state level and see what things you can get bipartisan support if possible. And I think that the way that Texas has done it has been amazing. And I think other states, and especially start with the low-hanging fruit, start with the states that are already pro-life, that have the support, and introducing those types of bills will vastly help women, as we know that pregnancy centers have a lot of extra clients, especially not only abortion-minded clients, but angry women who are kind of caught in all of this. And so I think just making it easy for them to support women would be the most effective way to make a difference. And going off of what was already said, it's also important for us to help whatever way we can, whether it's volunteering or monetarily, but also some of these pregnancy centers will need legal support. So if you're a lawyer, or if you're a doctor and they need some medical support, those are ways that we can take action right now, even apart from the political process.
Fantastic. Thank you so much, Arena. That's all the time that we have right now. I want to thank our presenters for sharing their perspectives with us today, and also for all of you who came and joined us and are supporting the pro-life movement and trying to find out these innovative ways of moving the discussion forward. I do want to remind everybody that a recording of this discussion will be available on the NCBC, the member section of the NCBC website, and the question and answer session will be publicly available on our YouTube channel. Thank you very much, and I hope to see all of you again at the next webinar.